We had a consultation weeks after hip arthroscopy, and there was...
Probably about 2 years before the operation I started to feel it was just sore in certain movements, and then it got gradually worse and worse, like pain in those movements, and then started hurting in other movements, and then just in general life as well.
We can progress according to the plan.
Some days I just have to be like, no, I can't do any more because of the pain. Like, I'd push through it as much as I could, but there's a limit, like, and you need to be able to train the next day, so you have to be careful. I went to my physio to start with and had like a few sessions with them to see if they could help or anything, but it wasn't getting better, so I had a scan on it eventually, which showed the labral tear.
People like Francesca, they are presenting with what we call a femoroacetabular impingement, where there is a conflict between the ball and the socket. They do not fit into each other very well, and when you're doing movement at the extreme, one component is hitting the other and damaging the seal around the socket, which is the labrum, and also the cartilage itself. We are faced with a challenge here. For somebody like Francesca, you're looking at a person if they can run most days of the week, but they cannot compete at the elite level, your treatment for them has been a failure. What is the underlying pathology which is causing this damage? And that is the impingement and thus conflict of the bone. And you deal with that by resculpting the femoral head, and in some cases by resculpting the socket itself. The option here, of course, is that at a suitable time we can intervene with keyhole surgery, we can repair the cartilage damage, if need be we can do some regenerative procedures for the cartilage and repair the labrum. Most patients benefit as long as the job is done properly, and job is not done properly until the rehabilitation package is complete with it.
And that relationship with the consultant is paramount, that they are really pro-physio, they really understand that rehabilitation is important, because if they are, then they can bring that over to the patient initially, so that patients are understanding that expectations that, you know, the surgery isn't alone going to cure their problem. And certainly the relationship we built over, you know, with the Spire lead consultants here are excellent, really, and we just want to try and build that even further, because ultimately it benefits the patient, and that's what we're all about, really.
I think it was important to have it done whether I was going to compete again or not, just for my health of my hip. Like, if it meant I couldn't compete, that would have been a decision I'd have had to make. But I'm very glad that I can continue, and it's very slow and process getting back into it, but I think I'm going to end up stronger from it, from all the extra exercises and things that I've been doing.
So Francesca, what we're going to do now is we're going to test on your affected side how strong your hip is, okay, when you pull up your hips.
The ultimate goal is really to take them through a stepping stone of progressive rehabilitation, really, to get them back to function. I think that's the real key thing. And it's not just about getting their hips stronger or getting their movement better, because obviously these are athletes competing at different levels. We want to get them functionally better to their particular level of sport that they want to do. So it's all well and good them being pain-free and walking and doing day-to-day things, but we want to go beyond that.
Keep going, well done, all the way. Keep going. Keep going, pull up as hard as you can go.
Cybex is a really, really important tool to sensitively assess muscle strength. The Cybex really allows us to understand these subtle differences that they may well have, or subtle imbalances, so we can really pick up on those, and it gives us an accurate objective marker of knowing what their strength is and where their deficits lie. And that then gives us really good information then to target that area specifically in their rehabilitation, and then we can give that information to her coaches, her strength and conditioning coaches, her physiotherapists, and they can then work with her on that, and that will be, you know, rectified, and that will be a beneficial outcome of that will be that her performance should be better.
Okay, so we're just going to orientate you about the altitude, okay?
After a couple of months, it was like a shock. Oh yeah, actually, that pain that I had last year isn't there. Like, it's quite a weird sensation, like, because you've got other pains and training pains and things, but it's different to the actual soreness that was clearly an injury. My hip's always going to have an issue. Like, it's not ever going to be as strong as a normal hip would. So I think it's really, really important to keep on top of it and make sure that it can be as strong as it possibly can, like especially for whilst I'm continuing training, just to make sure that everything's going. And I don't want to go back again and end up ruining my hip again. So the big goal is Commonwealth Games. So just I want to be able to compete by the end of this year probably. I've kind of given myself a long time to get into it again.
It's not an individual-based decision. Their physios have to be involved. At my end, myself, Richard Villa, we have to have, as surgeons, have an input into it. But then there is a whole heaps of rehabilitation staff. We've got sports physicians. Some are associated with ourselves. Some are associated with Francesca's outfit, say in Cardiff, who need to be involved. The physiotherapists. We have an excellent physiotherapy outfit here in Cambridge. But then these patients go away. In fact, 85% of these patients, like Francesca, come from outside of this place. We have to have a network of those people helping us achieve what she wants to achieve.
Everybody talks to, like, my physio will be able to get in touch quite easily and make sure that I'm doing the right thing. So it's a really good process of, and just the organisation of like being able to go into a consultation 1 week and then have it all sorted and finished the next week. Like, you know, it's just been really organised for me.